Welcome everyone. So in this episode, I wanted to talk a little bit about SDK and APIs and how those can be leveraged in research. So SDK stands for Software Development Kit and API for Application Programming Interface. And I think the APIs and SDKs have had a growing importance in research, and in modern research settings, data collection analysis tools must be both powerful and adaptable. And the SDKs and APIs are the adaptable part, and they can transform how researchers collect, process, and utilize data. And these tools provide the flexibility to design custom workflows, automate processes, and integrate data seamlessly into analysis and feedback systems. And at Fibion, we try to provide a very well documented SDKs and APIs for our products. So we have these, for example, for our Helix, we have it for our Vitals, we have it for our Sense, we have it for our MFit and Flash devices. So they all are equipped with well-documented SDKs and APIs that make leveraging these tools effortless for researchers. So if we then look why SDKs and APIs are essential for research and especially large-scale research. So they provide customization and flexibility. So for example, SDKs allow researchers to tailor data collection processes, ensuring that the data aligns perfectly with the study's objectives, and it makes it just much more efficient when you can customize it to fit your study's need. And then there is data integration and automation. So this is mainly for APIs. So you can simplify the data flow. You can enable automatic uploads, for example, to databases or analysis platforms, which is really of value in large-scale studies. If you're doing a small-scale study, it might be more work to use the API. But when we are talking about, for example, hundreds or thousands of participants, it just makes it so much more effective to handle the data when you have set up good APIs. And this really comes then to scalability and efficiency. So APIs and SDKs can save time, save resources by automating repetitive tasks and providing scalable solutions for studies, especially involving numerous participants. And basically you can use these for custom data access. As we talked, you can, for example, access the 3-axis acceleration, heart rate, physiological metrics. You can use real-time data streaming when the device is supporting this. So you can basically have real-time data streaming, which can be used in interventions, or it can be used to check the data, or if you have heart rate guided training, you can stream the data directly from the wearable to applications that the participants are using, and you can control the intensity of the training with this build system. Or if you are using ecological momentary assessment, you can stream the data to the device and you can use activity triggered questions. For example, let's say that the 3-axis acceleration device worn on the thigh detects that the person has been sitting now for more than 1 hour. It could ask, for example, that where are you sitting, or it could alert that maybe it's time for moving. So you can create these kind of things. And you can create customizable output. You can develop specific metrics which can combine, for example, different signals, or you can apply unique data processing pipelines to meet the exact requirements of your study. And if I give a few words about our SDKs and APIs, so For example, you could create really nice long-term studies with our Sense device that has 22 weeks of battery life. You could automate that the data is uploaded all the time to the system that you want, and participants could be just wearing it continuously or intermittently, and you would get a really long data without participants needing to charge the device. Or if you use our MFit bed sensor, there's minimal or zero participant burden after they just put it under their mattress. It doesn't need to be charged as it's plugged into electricity, and it automatically uploads the data. So basically, people could be just sleeping on their bed. The SDK and API is taking care that the data is processed, stored in a way that you want, and you would get data from every night for long durations, and this could give really nice possibilities for long-term studies. And also the Fibion Helix, it's just a simple wristband. It's easy to collect long-term data, and you could be giving certain feedback for participants when you want and how you want. So then if I recap the benefits of SDKs and APIs, so they offer unmatched flexibility and efficiency, helping researchers collect, process, and analyze data with ease. And if you're interested in learning more about our SDKs, APIs, and solutions, feel free to book a call with me or Dr. Miriam Caprita from our website fibion.com. Thanks for listening and have a great day.